Post-operative instructions, bone grafts. Initial home care. Once home and comfortable, remove the gauze packs from the surgical sites. After removing the gauze, it is important to get food and fluids back in your system. Eat a soft to liquid diet while the numbness is present, i.e., yogurt, applesauce, mashed potatoes, soup, or a protein shake. No straws. The suction can encourage bleeding. Take pain medication and antibiotics as prescribed once you have eaten. After eating and taking the pain medication, you may want to lie down with your head elevated. Drowsiness may last for several hours. Plan to rest and take it easy for the remainder of the day. Do not work or drive for 24 hours following surgery. Bleeding. It is best to periodically evaluate the surgical sites for bleeding. If bleeding continues, place a piece of moistened gauze directly over the surgical site and bite firmly with constant pressure for 30 minutes. Pressure is key to stopping the bleeding. This may need to be repeated several times. Slight oozing or intermittent bleeding is normal. Discomfort. Prescription pain medication should always be taken with food to reduce the risk of nausea. If you are able to take Advil or ibuprofen, 600 milligrams every 4 to 6 hours can safely be taken with or alternated with the prescription pain medication. This will help control breakthrough pain. Nausea. Occasionally, nausea may occur after receiving anesthetic medication or while taking prescription pain medication. Eating frequent meals and staying hydrated can significantly reduce the chances of nausea. Should nausea occur, drink small amounts of carbonated beverages, Coke, 7-Up, or Sprite. Anti-nausea medication, such as Phenergan or Zofran, may also be used, as directed. Swelling. Swelling will occur after surgery and will vary with each individual. Swelling is usually noticeable in the morning after surgery and may increase over the first 72 hours. Cold compresses, ice packs, can be used to limit the amount of swelling that can occur in the first 48 hours. Alternate applications 20 minutes on, 20 minutes off. After 48 hours, it is best to switch to warm compresses, heating pad, or a warm washcloth. Alternate applications 20 minutes on, 20 minutes off. Jaw stretching exercises and cheek massages will also help reduce swelling and limited jaw opening. Diet. Maintaining a proper diet is very important to your recovery. Eating regularly will make you feel better, help you regain your strength, and heal faster. Once the numbness has dissipated, solid foods can be reintroduced to your diet. You may be on a softer diet for a day or two. Advance to normal diet as tolerated. Try to avoid foods like nuts, seeds, and popcorn that may irritate the surgical sites. Do not drink alcohol for 24 hours following surgery or while taking prescription pain medication. Avoid using a straw for a couple of days to reduce the risk of dry socket. Oral hygiene. Do not rinse your mouth the day of surgery. Leave the surgical site undisrupted. Do not smoke for at least 72 hours. Smoking delays the healing process and commonly causes dry sockets. The day after surgery, start rinsing your mouth every 3 to 4 hours after every meal with warm salt water. Gently brush your teeth in a normal manner as thoroughly as possible, avoiding the surgical sites. The surgical area will have a collagen membrane and suture protecting the freshly placed graft. It is best to protect this area for a few days while the initial healing process starts. Try to avoid chewing directly in this area. Avoid using mouthwashes with high levels of alcohol. Healing. The first few days are the most uncomfortable, followed by gradual steady improvement. If you don't experience continued improvement or feel you are getting worse, please call our office. All bone grafts will need to heal for 4 to 6 months prior to placement of dental implants. If sutures were placed, these will dissolve on their own in 7 to 10 days. The surgical sites will usually swell and may become quite large. You may have difficulty opening due to stiffness of the muscles. You may develop a sore throat or have a slight earache. Discoloration may occur on the outside of the face near the area of surgery. This occurrence is not unusual and will resolve in several days. You may develop a low-grade temperature. Call the office if the temperature continues for more than 48 hours.